Hi everyone and welcome back. My name is Dr. Carmen. Today we're going to be talking about the 5 best exercises that you can do for scoliosis. The first exercise that we're going to be performing today is pelvic tilts. So for this exercise, what you're going to do is you're going to lie flat on your back, okay, with our knees bent. So here we are, flat on our back, arms by our side. And what we're going to do next is we're going to pull our abdominals towards our spine while tightening our glutes. So what that looks like is this. Here, you're going to hold for 5 seconds. 5, 4, 3, 2, 1. You're going to breathe normally through it, and then you're going to relax. So again, we're going to do this again. Tighten the core, squeeze the glutes. Hold for 5 seconds. Breathe normally and relax. I want you to repeat this exercise for 3 sets, 10 reps each, once a day, in order to get the full benefits of this exercise. All right, the second exercise that we're going to be talking about today is also known as cat camel. So what does that look like? So you're going to get on all fours, okay, with your head neutral. And now you're going to bring your core, you're going to tighten your core. We want to make sure we have a tightened core. And then what we're going to do is we're going to go ahead and take a deep breath in to tighten that core. And we're going to curve our back like a camel. Hold it, and then you're going to exhale and drop the lower portion of your abs. So again, inhale, exhale. You really want to hold that tight core for about 5 seconds. So inhale. Exhale. Also, another thing that you can do to get a good stretch is bring your neck up with a nice good stretch. So again, we're flat on all fours. We're going to go ahead and tighten the abs. Inhale, bring the abs towards our spine. Exhale. Get a nice good stretch. So we want to repeat this exercise for 10 reps, 3 sets, at least once a day. Alrighty, so our third exercise is the double leg abdominal press. So what that looks like, you're gonna lie flat on your back. You really wanna make sure that your back is flat on the floor. So make sure you are flat, all right? And then what we're gonna do, one at a time, we're gonna bring each leg to a 90-degree angle. Just like that. Then we're gonna put our hands straight on the knees. And what we're gonna do is we're gonna push our hands towards our knees while pulling our knees towards us, right? So what that looks like, it's like this. And as you're doing this, you wanna take 3 deep breaths in. So what that's gonna look like is the key here is to maintain neutral spine in your lumbar spine, okay? And again, you're pushing your hands towards your knees and you're pulling your knees towards your hands. So that is why whenever we lift one leg and the other leg, we make sure that we maintain that neutrality of the lumbar spine. Hands on the knees, push the knees, pull the knees towards you. 3 deep breaths in, and that is your exercise. Repeat 3 sets, 10 reps to get the benefit of this exercise. Our fourth exercise is single leg balance. In order to get the full benefits of this exercise, it's best to do this exercise in the mirror so you can see exactly how well you're balancing your spine. In the beginning stages, you might need to use like a wall or a chair for stability until we improve that stability and strength. So what that looks like is, with your eyes open, right? You're gonna go ahead, you're gonna bend one knee and balance on one foot. at first, like I said, you may use your hands like holding the back of a chair to balance yourself. And eventually, as balancing gets easier, you are going to take your hands off that chair and you're gonna place them out to the side or out in the air. And then eventually you're gonna challenge yourself by bringing your arms across your chest. And to make it extra hard, you maybe close your eyes for that balance. So again, we're here, we are bringing the leg up. The important part here, in order to maintain that balance, believe it or not, is focusing on one point. That is your point of focus. Then the glute's gonna be engaged. I'm tightening my glute and I'm gripping the floor with my toes, and at the same time, my core is engaged, right? So that is what's going to give me that stability. So again, when we start this, do this barefoot, by the way, okay? So I have my foot on the ground, sitting up straight. I bring my leg to a 90-degree angle. Notice that my foot is gripping the floor, my glute is engaged, my core is drawn back and it's engaged. So now I can bring my legs to the side to challenge myself. I can go ahead and cross those arms, or I can close my eyes. Now what you want to do, you want to hold for 10 to 20 seconds and repeat on both legs. And if you feel like you're balancing all over the place, remember, pick one spot on the wall in front of you at neutral eye level and focus on that. And I promise you, you're not going to be losing your balance. So I want you to repeat this 2 sets, 5 reps each side, at least 1 time a day. The 5th and last exercise is the plank. So how do we perform a proper plank? Most times when I ask the patient to perform a plank for me, what I notice is the butt's too high and the abs are not engaged. So let's talk about how to perform a proper plank. So of course, the first thing is you're gonna get on your knees, right? And I'm gonna get on all fours. Shoulder width apart, my shoulder blades are engaged. I'm kind of like a push-up position. Then I'm gonna take one leg back at a time, and you should have a straight spine at this time, right? Then after this, what I'm gonna do is I'm gonna squeeze my butt, and then I'm gonna bring the core in. And now, this is a proper plank. My core is engaged, my glutes engaged, my shoulder joints are completely engaged, and it's safe for me to leave my body weight into those shoulders, and I'm not getting tired. So through here, I want you to challenge yourself to hold that plank for 30 seconds at the beginning, and then a minute, and then a minute and a half, and then keep going up from there, right? So in order to get the full benefits of this exercise, I want you to plank at least, 1 time a day, do 3 sets, and do like 30-second holds, maybe 5 of those in the beginning, and then progress to maybe doing a 40-second hold, and then 50, and then go to a minute, and then keep challenging yourself to hold that plank. So I hope this helps you out so much, and thank you so much for watching this video. And if you have any question, ask your corrective chiropractic doctor. We'll be more than happy to help you.